Welcome to Healthcare in Hawaii. I'm your host, Josh Green, Senator from the Big Island, ER physician, and Medical Director at the Hawaii IPA. Today I'm excited to have a more interesting show than many other occasions that we've had. This is something that is really affecting all of us on the planet. We're going to speak about climate change and health. And I have an expert today, Nancy Partika, who's the president of the Hawaii Public Health Association. Welcome, Nancy.
Thank you.
Good to have
Good
you
to
here.
be here.
So you have a great deal of breadth of experience in public health. You also were a past director of the our Hawaii Governor's Committee on HIV/AIDS,
Yes.
DOH Division Chief for Health Promotion, Maternal and Health, Healthy Policy Leader. I mean, you've had a really good public health experience. So I look at you as somebody that can tell us exciting things about many areas of health. But when we met and thought, what would be a novel topic to have, an emerging topic, you came up with climate change and health. So why don't you tell me how you got interested in this?
Well, as you've mentioned, I have about 30 years plus background of public health in Hawaii. I started initially as a registered nurse, and I did services in the healthcare area. And then I decided to focus more on the health and the wellness side, the promotion side of things. So over the years, I've had many, many interesting areas to work in. But I think I got involved in climate change and health about 5 years ago. I do not consider myself a subject matter expert, but I think all of us have a strong vested interest in this issue.
Yes.
So the reason I'm involved is I started teaching it to undergraduate students in public health at the University of Hawaii Office of Public Health Studies. I taught it in global health and also in just Public Health 101. And as I got more and more involved in the issue, it just became obvious that there was this tsunami coming that basically was the climate change issue and how it would affect health. And what spurred me on even more was in 2012, I had the opportunity to visit Shanghai as a visiting faculty member. And while I was there, Shanghai had 27 million people living there at the time.
Wow.
So huge city, many, many challenges. And it sort of got me thinking even more about climate change and health and how was it going to affect major megacities in the world, but also how was it going to affect Hawaii. And wanting to hear the voice of health, of public health in that discussion, I really appreciate all of the discussions that have been occurring by the scientists and the community that studies climate change and atmospheric change and ocean sea level rise. But I think the public health voice has been really kind of muted up until now, at least in Hawaii. So I'm really trying to sort of become more of an advocate for more people to enter that discussion.
Well, I can tell you it's been a very welcome and refreshing kind of nudge to have you there, injecting this part of the dialogue, injecting climate change as a part of the public health dialogue. Because even just thinking back 5 or 10 years when I was first chairing the committees here at the Capitol, it really was not a part of the dialogue. I mean, we all watched An Inconvenient Truth from former Vice President, almost turned President Gore, who I was very fond of, and I was so pleased to see that. But there's always a little bit of a contentious moment on the political side, at least. It's not something that I've worried about, but I really have wanted to see more of this dialogue in public health, and you're helping to make that happen. In fact, you showed me a list of people that you've been working with. You've convened quite a terrific group on the Committee for Climate Change and Health Working Group. You've got Dr. Pressler, who's been on our show. There's you, there's Jessica Woolley, Nancy Lewis, so many wonderful people here that I see. Jessica Yamauchi's been on our show, Robert Hirakawa, all these terrific thinkers. When you guys get together, what's the conversation like? Give me an idea of the scope of the problem right now.
Well, let me go back first and just say that the Climate Change and Health Working Group is a result of a healthcare resolution that just passed the legislature this past year. It is an unfunded mandate, and it directs the Department of Health to convene a working group. And the Hawaii Public Health Association is co-chairing that process because we really pushed for this resolution to pass. So we're very pleased to be working with the Department of Health on this issue. It has just recently convened, actually. We had our first meeting on August 20th.
Yes.
And we talked about just a general overview of climate change and health, what the resolution said in terms of the mandate of the working group. And we also talked a bit as well about surveillance. What would we need to have in place as sentinel or baseline surveillance to really be able to pick up some of the changes in the environment that in turn may well or are already impacting on our health in Hawaii.
Give me an idea. What were some of the moments like in that first meeting? What kind of comments were made from yourself and some of these other members? What are the biggest concerns that are coming up for our audience that might not really have had a lot of experience with climate change and health?
Right. I think the main thing that I noticed was that when you convene 15 people from very different backgrounds, law, medicine, public health, the military, you get a really kind of diverse view of what's going on. And again, we've just started the dialogue.
Right.
But I think what I pick up is we're finally having an opportunity to really focus specifically on the health impacts due to climate change. And some of those impacts that we expect to see in Hawaii, we've been talking about with our Hawaii Public Health Association membership for the last 2 years, and that includes if there are any chronic diseases that are present, they may well be accelerated or exacerbated by climate change impacts. And we only have to look, for instance, at the current weather in Hawaii, where we haven't had trade winds for quite a long time.
Yes.
And the impacts of the heat and how that's affecting people, and not just their productivity, but their actual, their health status.
And you mentioned to me before we came on, and I recalled this then, that when we've had extreme heat spikes and heat waves in different parts of the world over the years, for instance, France, we saw incredible suffering and in fact, a spike in mortality and morbidity. Do you think that could happen to us here in Hawaii?
Hopefully not, and that's why we want to be proactive. We at this point are at a point where we need to adapt to what is already occurring and what will continue to occur. According to the scientists who are studying climate change, the impacts are going to occur for a good 20 to 40 years, and they're going to intensify.
Yes.
And that includes heat, that includes rising sea level. There are a number of other impacts, and we may not even be able to predict all of them in advance. So the question is, how can we shore up our current system and really look at our efforts in terms of how we address, for instance, heat?
Yes.
And everything from, children in schools to elderly in unair-conditioned apartments to people who just have no access to cooler environments. And how are we going to kind of stage that? Also, the quality of the air. Our water supply will be an issue, and there are folks that are certainly paying close attention to that, because when water scarcity occurs, when the sea level rises, then our land mass will also be affected, our ability to utilize space that we currently have. And I think we have to take all of those things into consideration. I think it's hard to wrap your head around all of the complexity of it, and that's why it frightens people. I think that's the reaction I get more than anything, is we're kind of afraid about how we address this issue. But on the other hand, if we don't start addressing it and looking at how we best adapt, then we're going to be in a reactive situation, and it will always be an emergency. It will always be a disaster.
Yes.
And how long can you maintain a disaster response to something that goes on for a prolonged period of time?
It will persist. Playing catch up.
Absolutely.
Playing catch up to, and basically we're talking about global warming is the main theme, so we can be explicit about that. Playing catch up is a challenge. It sounds to me like you're talking about some very large issues, so I'm pleased that the group is coming together, because it sounds as though you're talking about urban planning, you're talking about long-term planning for additional resources and investment in certain parts of health. You're talking about schools. Probably, I would assume, correct me if I'm wrong here, that this is also a question of economic equity. If a certain part of our people is living...
Social equity, absolutely.
If they're living in poverty, they're going to not have access to as much climate-controlled environment. Their schools might not be as good a setting for their children.
Well, any any sort of environmental, we live in a built environment, which
Yes.
means we're affected by what is around us. And if we don't address those issues proactively, then we'll be addressing them reactively. We also have to deal with the fact that this is a planetary issue. It's not just happening in Hawaii. It is definitely happening in a big way already in the Pacific. Parts of the Pacific are already losing atolls, and their water supply is disappearing and their ability to grow crops.
Yeah.
How much of that will occur in Hawaii? We need to sort of plan ahead very proactively on those issues. So it's going to take a lot of coordination from a lot of entities who have not really talked with each other up until now. Agriculture, economic development, education, health, obviously, human services, just about every area will be involved in this. And so, and again, we may be seeing more and more environmental refugees.
Yes.
And the environmental refugee issue is something that many people are already picking up on and is expected to intensify over the next 20, 30, 40 years. So we not only have to consider our current population, but think about people who may be moving from less, how would you put it, less advantageous
Yes.
situations to what they think is a better situation. So there's going to be a lot of movement going on, and the security.
I'm glad you mentioned that because 2 shows ago I had some really wonderful speakers who are leaders from the Micronesian community.
Yes.
And I don't know if you're referencing them in your mind right
Yes.
now, but yeah, a lot of the individuals, not just because of the Compact for Free Associated States coming with individuals coming to Hawaii, but also many of them have lost their land. They,
Yes.
like you said, they can't grow. Their ag community has been devastated, and of course they're going to come here first. And we have to be prepared to be compassionate to individuals that seek a more stable way to live. And that's not without an impact, of course, on our schools and our system.
But that may not be the extent of it. It could be people from elsewhere where there are wildfires, or where there's drought.
Yes.
So we really, again, should anticipate that there will be people moving within Hawaii and beyond Hawaii to more advantageous environments. And that how do we adapt to that? Not just accommodate, but how do we adapt, given that we already have a largely imported environment?
Yes.
And so, and if our supply of water or other things, food, stops coming in because they're no longer producing it in an area, how do we adapt to that? So there's a lot to consider, and health is really such a broad issue.
Right.
It's not just the absence of illness, it's actually your well-being, physically, mentally, and emotionally. How are you optimally living? And so it's a really tall order to think about all the health implications. The ones that are most of concern, I think, are, again, chronic disease conditions, respiratory, even cancers, airway diseases, nutritional impacts from either not having the right kind of food or not having enough food, not being able to grow our own food. Contamination, if we saw what happened with the spillage that occurred just the other day. How are we going to handle impacts in the future where our water is compromised? Cardiovascular disease, we have quite a bit of that in Hawaii, and how will that be impacted by climate change? Vector-borne diseases could totally change.
Yes.
And again, waterborne diseases, which we were reminded of yesterday. So all around us, I think there are kind of indications that things are happening, but not at the point yet where we feel very uncomfortable. But they will get that way, and the question is, at what point do we start showing the leadership necessary to make the changes that we need to make?
Excellent. Well, that's a perfect overview. I think this is a good time for us to take our first break.
Yes.
I'm Josh Green, your host at Healthcare in Hawaii, Senator from the Big Island. I'm joined by Nancy Partika, who is helping to educate us and organize us on the issue of climate change and health. Thanks for joining us.
I'm Ethan Allen. I'm the host of Likeable Science on ThinkTech Hawaii. We talk about why people should like science, why science is actually fun, how science is a dynamic and vital part of everyone's life, why everyone, every man, woman, and child on the planet should really know science, should love science, should be familiar with science. So it's a great show. People come on here and have interesting conversations with us. They tell us why they do what they do, why they love it, why we should love it too. I hope you'll join us every Friday, 1 to 2 p.m. And of course, you can see it anytime on YouTube. Aloha.
Aloha. Welcome back to Healthcare in Hawaii. I'm your host, Josh Green, Senator from the Big Island, ER Doc. Today I'm joined by Nancy Partika, and we're talking about climate change and health. In our first 15-minute segment, Nancy was very good outlining the scope of the initial challenges that she and her group, which is a work group that's been formed by the Hawaii State Legislature, have begun to unpack the question and problem. But there's a bigger community out there. Talk to me, Nancy, about the national, global partners that you see working on this issue. Give me a sense of how big this question is and who's working on it.
Right. Well, it's global. And I mean, the Intergovernmental Panel on Climate Change, it's called IPCC,
Yes.
has been putting out warnings, reports for years, and in 2010 specifically addressed the issue of the expected impacts of climate change on human health.
Okay.
So we do have a large group of scientists internationally that look at this issue and put out reports just about yearly on this, and they predict by the mid-century, 2050, that climate change will definitely be impacting human health, mainly by making existing health problems much worse.
Okay.
And they have a very high degree of confidence that that's going to occur. That's not that far away.
Right.
And it's not going to happen suddenly. It's going to happen over a period of time. Also, they predict that we're going to lead in more ill health in many regions, particularly in developing countries with low incomes. So there's going to be winners and losers with climate change.
Mm-hmm.
Those in the more temperate climates that have more resources will probably do somewhat better,
Mm-hmm.
depending on where they are.
You mean they'll have the capacity to deal with the change, so
Right.
they'll have the infrastructure and health to deal with worsening asthma and chronic lung disease and all the many things that you mentioned.
Or they may not have as much of an impact depending on where they are. I mean, I'm sure you can imagine there are people that would say, I wouldn't mind a 2 to 3 degree change in the weather because our weather is too cold.
Yes.
So I think the northern countries generally will fare better than the southern countries.
Yes.
Those near the equator are lower. So there will be a north versus south kind of issue. But the other thing that is going to occur is just greater likelihood of injury, of death and disease, intense heat waves and fires, and we've certainly seen on the West Coast that the fires that are occurring are a chronic situation now, and will definitely affect our ability to access food because, again, we import virtually everything we eat.
Yes.
The other thing is undernutrition, reduced food production, lost work capacity, lost labor capacity, and again, the food, waterborne disease, and vector-borne disease in addition to the other chronic diseases that already occur.
And all
so
of those
a wide
things,
range.
Yeah, all those things could be very disconcerting. I mean, first of all, drought, right?
Yes.
Drought and subsequent famine sounds
Yes.
like a,
Or floods.
or, right.
Right, so you don't want either extreme.
Right.
Because in a disaster situation, you expect that you'll have the ability to recover and rebuild. But if that becomes progressively more and more your way of life, the way things are,
Yes.
then you're in a constant disaster situation. And so the question is, how do we adapt to a changing environment?
Yes.
And for some people, it's going to be much more intense than others. Other partners who are involved in this are the Centers for Disease Control, which is kind of our gold standard in the United States for health and public health issues.
Mm-hmm.
And they are very definitely very involved in the issue of climate change and health. And they recently had a round of states that received money for something called BRACE, Building Resilience Against Climate Change. And they had states that they provided technical assistance to on the issue of how to build resilience, how to be able to adapt to it for their unique situation, because every state, every region is different. So how do you adapt to the challenges that are going on and will likely go on in your area? And then the American Public Health Association, which our Hawaii Public Health Association is an affiliate of,
Yes.
has been very, very strong on the issue of climate change for at least 8 to 10 years. So we're a bit behind the times. We actually have been kind of delayed
Yes.
because we feel like we're in a fortunate situation in Hawaii, and we don't always feel like we need to respond just because everyone else is responding. But in this situation, I think we have to recognize we're an island state. We're very dependent on outside resources. We will have challenges due to increasing or rising sea rise level.
Yes.
Right now, the expectation is that, with the Blue Line project that Dr. Chip Fletcher has done, that we're going to see significant impacts on some of our most treasured resources in the state relating to tourism and economics and so forth. So we really need to be looking at that, but keeping in mind the health implications as well.
Yeah, I don't think people realize how large a challenge that could
Yes.
Could pose. For instance, if we had a major hit on tourism, it resonates through the entirety of what we do. It
Right.
means that there's fewer dollars for our health budgets, our public safety budgets, our education budgets, all of which will be, focused on keeping people well. But if there's just 20 or 30% fewer dollars coming to the state of Hawaii,
Significant.
that could be very catastrophic.
Yes.
In many ways as dangerous as a shortage of supplies
Yes.
coming to the state.
Right, because I think it will affect people's ability to take care of themselves and others, particularly those who are more vulnerable.
Yes.
So that's real problematic for us. I mean, we have to put public health and health in the context of the larger picture of climate change,
Yes.
but we have to be at the table. And I think up until now, we really haven't been at that table, that discussion. And it's great to see the science that is occurring behind climate change studies,
Yes.
because it's giving us more and more of an ability to really measure the actual and projected impacts on what is going on. But as the health and public health experts,
Yes.
we have to weigh in on what that will mean. So that's why health and public health need to step up and be more involved in this issue collectively.
It sounds to me like there's very little or no doubt in your mind that we are dealing with climate change.
Yes.
That's an established position that
Yes.
you come from, and I have to say I share that position. In fairness to our viewers, is there anyone that you're working with in this group, for instance, that plays the other card, that feels that really the challenges that you've expressed today are not imminent or not as worrisome?
Yeah, I think there are definitely people that don't believe in climate change at all. There are people who believe that climate change may occur here, but not there, but not here.
Yes.
So until you actually feel the impacts, like the Pacific Islands,
Yes.
are the Western Pacific is feeling in the Southern Pacific, it will not be as real to us.
Yes.
But it's sort of like the frog in the cooking pot,
Yes.
where if you throw a frog into boiling water, they'll jump out.
Yes.
But if you put them in the water when it's warm
Yes.
and then you turn it up, they'll stay in there. They don't have the sense to jump out.
Yes.
Even though they're getting more and more uncomfortable. Hopefully, that will not be the situation with us, where we wait until the heat in the pot is literally so strong that we have no choice
Yes.
but to address it, and it's going to be reactive rather than proactive. So what I would say is, for all of us, we all have a vested interest in this. There's no one that has an opinion that shouldn't be heard. But I do believe that we need to move forward on this, because it will take time and resources to plan for adaptation. And we're not talking about, if this occurs, we can do this for a limited period of time. We're talking about basically a new environment, and as the next generation takes over, their environment is going to be quite different than ours, and then the following generations. So I think we owe it to our future generations to address this as responsibly as possible now and not put it off to them.
Yeah, and I think that a lot can be said for planning under any circumstance.
Right.
You made a very good point earlier, though, and that's that even if one were to decide that global warming is affecting some areas worse than others,
Right.
we are such an interconnected global community now
Yes.
that we have to be prepared if that means that beef costs or vegetable costs are much higher. As we all know, in Hawaii, we also pay already a premium for living in Hawaii.
Yes.
That to get adequate nutrition,
Yeah.
we have to worry about what that impact would be. And by the same token, if land is even minimally affected on some of our neighbors and they become immigrants to our state, we have somewhat finite resources that we have to find a way to share and work together. And
Right.
as you know, if another 100,000 individuals came and lived in Hawaii, we'd have to work very hard to make sure we have resources. We don't even have enough resources, as we can see when we walk around Kaka'ako right now, to get everyone homes, which I think is,
Right.
an abomination that we can't take care of everybody, at least in a basic way. So, for goodness sakes, if a lot more people come and need our help, we better be prepared. And that seems like what you're working on.
And that's actually occurred. It's occurred in Kiribati, where their islands are virtually underwater.
Wow.
And so they've actually purchased some land in Fiji. And there was a back and forth for many years because people from Kiribati did not want to move.
Yes.
They wanted to keep their home and their culture, but it was going underwater. They couldn't grow anything. And so Fiji has actually opened its arms and said, we will take as many people, and we're talking about, I think, 100,000 to Fiji. And I'm not talking about the fact that this absolutely will occur or
Yes.
when it will occur, but I think we have to recognize that if we were in an untenable situation
Yes.
where we couldn't support ourselves or feed our family, that we would do the same thing.
Right.
So it's something to think about that environmental refugees it's already occurring, but it's occurring in areas where the effects, the impacts are already significant.
Yes.
And Hawaii appears to be in a good situation right now. The question is, are we being challenged already with the impacts of climate change? And I would say, yes, we are. And this is the time, though, to do the planning and the coordination and not wait.
And that refers us again back to the group that you're a part of and that your organization is co-convening.
Right.
You guys are speaking from a very broad perspective. You told me earlier that you, like I mentioned a couple of things, but you also have scientists, you have civil defense figures, you have
Yes.
People from the Department of Health, but you have people from a lot of areas. I suppose you'll also be able to get input from the development community, the urban planning community, and others.
Probably not within the scope of this particular working group, but what I can tell you is there is a climate adaptation committee that the Department of Land and Natural Resources is running. And I think they're looking at more of a broader approach to climate change, and they're specifically looking currently for the next year at sea level rise.
Yes.
And really looking at that. So there's a group that is occurring that is looking at some of those broader issues. I think this initial group is really going to try to focus specifically at this point on just even identifying what we think the greatest risk factors are,
Yes.
how we can track or do surveillance on those issues,
Yes.
how we can shore up what resources we have, and how we can meet the core public health services and the health system services
That's
that
excellent.
are being affected by this issue.
So the DLNR group will be able to rely on you as a conduit of information,
Right.
dialogue.
Specific to health.
Excellent.
Right.
Well, this is a perfect place for us to take our second pause in
Okay.
our program. I'm Josh Green, your host on Healthcare in Hawaii. Today I'm talking with Nancy Partika, and our title is Climate Change and Health, getting a great overview. Thanks for joining us.
Hi, I'm Donna Blanchard. I'm the host of Center Stage here on ThinkTech Hawaii. Center Stage airs every Wednesday at 2 o'clock, and of course you can check out our archives on YouTube or on ThinkTech Hawaii anytime you like. Why should you do that? Because this is an arts show that I believe is making a difference in lives. We talk with artists of various ilk. We talk with painters and writers, playwrights, novelists, poets, sculptors, dancers, you name it, directors, actors, of course. And we don't only talk about what people do, but we talk about how they do it. And my favorite part of the conversation, we talk about why they do it. And it's really common on this show to hear people say, wow, I didn't think about it that way. And it's very common to hear people afterwards who have seen the show say the same thing. And I hear all the time that people are inspired by the conversations that we have. So why don't you join us and be inspired too? That's Center Stage on Wednesdays at 2 o'clock. We'll see you center stage.
Aloha, welcome back to Healthcare in Hawaii. I'm your host, Josh Green, Senator from the Big Island, ER Doc, and I work with the Hawaii IPA as a medical director. Today I'm talking with Nancy Partika, who has convened a large group of people with her organization to work on climate change and health. She's spoken very eloquently about the both short-term and long-term concerns that she has as to how global warming will affect the health of people in our state and globally. This is a very large question. Nancy also was able to tell us there are global partners that, of course, are on this matter, as is the Department of Land and Natural Resources that has convened I would express a part of their organization or committee, depending how you look at it, to also look at some of the broader problems. But Nancy, it's a big concern for
Yes.
us here. You've elevated the conversation and the dialogue in public health. You've put this on the map with many others that you respect. Tell us a little bit about this October 9th public health conference that's happening. I'd like to be able to encourage people to participate if they have something to share.
Great. Okay, the Hawaii Public Health Association has historically been around since 1945. So it's seen a lot of changes over 71 years. 70 years. And it was started actually by a dedicated group of public health professionals right after the war ended in the Department of Health. And it's undergone many, many transformations over the years. One of the things we really want to do is to promote health and health equity and leadership in public health in Hawaii and the Pacific. So one of our efforts is a conference coming up on Friday, October 9th, and it's called the Hawaii Public Health Conference, and its byline is "Health is everyone's kuleana," because it really is. You can't expect a provider of any type to do it for you. You really have to be involved. And so that's really thematic of this conference. So the things we're going to be discussing, we're going to have the president-elect of the American Public Health Association coming, and she'll be speaking briefly. And we will have a special panel discussion on health in the built environment. And what we mean by built environment is whatever is around you that supports health or takes away from your health status. So that could be anything from adequate sidewalks, streets that are safe or unsafe, just having a place in your community where you can walk, or you feel, sidewalks, again, that are safe to be on, pedestrian safety, all of the different things that involve food environment, including what kind of stores are in your immediate area.
Right.
And there are places called food deserts, where basically you may have stores that have a lot of alcohol or cigarettes or other convenience items, but they don't necessarily have healthy food. So do you have a farmer's market in your area? And is it accessible to you? So the built environment is a really big issue, and we want to underscore that. And actually climate change does, in a very big way, fit under built environment. What is our built environment going to be like in 10, 20 years in Hawaii? We don't know. So it's going to be interesting to see this panel discuss it, at least in a current sense.
And you'll be able to lob some questions, I assume, at them that reflect some of the hard work that you're doing on climate change and health. I mean, I know that these individuals are focused on the built environment,
Right.
but this is an emerging area which I think
Right.
everyone will have to deal with.
Right.
Tell me, you said that you have all these partners globally, and other states are also active.
Right.
What are other states doing, and who's been leading on this issue?
Wow. Okay. California has been involved in the climate change and health area since 2008, I think, or 2007.
Yes.
So they've been very proactive in this area, and statewide. They've put quite a bit of resources into it. And you can see, again, with the wildfires that are occurring, that that's something that, again, is something they really, can put this plan to use. The county of Multnomah, Oregon, has actually come up with a very good public health and climate change plan. There are cities like New York City that have also been very proactive. So we've actually seen a combination of cities and states who have really stepped up and developed a strategic plan around climate change and health, and they've done a really good job. Florida has a good climate change and health plan, but there are some states where climate change is not allowed to be discussed in the public sector, and that creates an environment where it's very problematic to deal with an issue if you can't say the words.
Yeah.
So I think in Hawaii we're at an advantage because I think we've always been it's fairly easy to talk to people
Yes.
that you need to talk to, and I think we have more of an informal environment, and we know that we're all here together rather than, going back and forth over a county line. So I think in Hawaii, we really have an opportunity here to really develop a good proactive climate change plan for Hawaii, but also something that the Pacific Islands could utilize as a potential model if they already do not have a climate change plan.
So you're saying we almost have to address this as a region rather than simply as a state, because not only could we be affected by individuals
Yes.
that we want to help or be supportive of, but also they are our neighbors. They're very likely not going to have other internal support in their own countries. In many cases, they're quite poor, or they don't have well-developed departments of health in some cases. So we might have to be, I guess, a willing partner.
Actually, I spoke recently to the Pacific Island Health Officers Association, and most of them are quite aware of climate change and health issues.
Yes.
But with the lack of resources and the challenges they face that are much more at a basic level
Yes.
in terms of public health than we deal with, I think climate change just adds an extra layer of stress
Yes.
to them. And they are feeling the impacts more immediately than almost anywhere else
Yes.
in the Pacific and also in the Caribbean. So, and that's where sea rise level is more accelerated
Yeah.
around these islands.
Yeah, and that's such an immediate impact, I think, that though many of the long-term impacts might be on so many levels, like you said, agriculture or vector-borne illness
Right.
or whatnot, I think in the immediate time frame, when someone starts to lose land or they
Water.
they lose clean water. I mean,
Yeah.
without clean water, no society can survive or
Exactly.
be maintained for long. So we are very privileged to have had enough wealth as a nation and as a state to not have water crises very often, but we're seeing that emerge. I mean, California's having a heck of a water problem, if I'm
Yes.
not mistaken.
Yes, they are.
And so that kind of
And we've
thing-
had droughts here,
Yes.
and those may well intensify under the climate change scenario. Our drought areas may become more drought-ridden.
Yes.
And so the question is, what's going to happen when, it's unsustainable to live in a drought area? Now, in Hawaii, we're talking about much fewer acreage than we would be on the mainland, but at the same time, we really need to be looking at all of those issues: food, water, shelter,
Yes.
disease, prevention of disease or adequate support, all of those things. And actually, with the core public health services, a lot of people don't recognize that public health is a separate entity from health, and that it's really there to promote optimal health.
Yes.
And so the question is, how will public health as an entity step in and play its part in a leadership role?
And public health, I think you and I can agree, has often been under-resourced, under-financed. People
Absolutely.
tend, when there are lulls in the government and there are cuts, unfortunately, some of the most important programs which can prepare us to deal better with our chronic illness and all of our health questions, those services and that wisdom gets cut.
Yes.
And we keep hospitals open, but we see, I think, a ripple effect, and we see that impact 5 and 10 years out sometimes when we didn't have good planning and we didn't prepare people for what will be a health challenge for them. And if this does come to pass and we have severe droughts, or if we don't have good public health ideas related to this challenge, we'll be, like you said earlier, behind the eight ball. We'll be catching up for reacting for decades.
Yeah.
So we only have a few minutes left. It's been very helpful to get an introduction to this challenge, and we'll have to speak more for sure. I often ask people on my show in a somewhat dramatic way, what keeps you up at night when you think about this discipline? What are some of the short-term challenges that could be really very disconcerting, if not catastrophic. What are the biggest concerns that you have as a person who's really trying to elevate this part of the public health dialogue?
I think the biggest thing is not seeing others jump into it and get involved.
Yes.
And that's, public and private sector. I think it's very important that people stand up and get involved in this issue. And collectively, we can try to address it, but individually, even department by department or program by program, that's not possible. This is too big for any one entity, whether it's a well-established Department of Health or the Centers for, you can't do it alone. It's too big. And that can be very off-putting to people, frightening. But I think collectively we can absolutely come together and really look again at how we best adapt to this changing environment and create the levels of intervention that are appropriate. And I don't think so that would be my biggest concern, is that people don't step forward. We wait until the water's boiling. And then we decide we need to jump out, and the water's boiling.
Yes, and I think you make a very good point, because it sounds to me like if everyone spent a small amount of their time and attention and resource in their organizations, even if they're not a traditionally health-oriented organization, that they should have, if they're an architecture firm, they should have someone that is mindful about what the impacts on a region's architecture, or their development company has someone in there that has some familiarity with these questions, so they can incorporate some of their planning. They can rely, of course, on the expert group that you've put together, and DLNR and other states are bringing, but everyone should be embedding this in their, I don't want to just say talking points, but in their thought process as they plan for the future.
Their contributions, because honestly, I think we absolutely need to break down the silos, and we need to really see this as a collective issue that everyone has an investment in. And we need to do it for future generations, because we still live in a relatively comfortable environment, even with all of the things that are occurring, but it will become more and more uncomfortable. And so, that's not what we want to leave as a legacy. But the estimates are, for the next 20 to 40 years, it's going to get increasingly hot. It's going to get increasingly more unpredictable in terms of the weather, or unfortunately predictable in not a good way. So, we're happy to have the situation we have right now. I think we are blessed in a lot of ways, but we need to take advantage of this opportunity and build the commitment of many people. So don't be afraid to jump in and contribute.
And I hope that when people see this program and hear you speak, that they take that message to heart. And I guess more pointedly, I hope that they don't wait to see a superstorm come and clear out an island, or they don't wait to see a terrible vector-borne illness cause a lot of morbidity and mortality in some region in the world, United States or elsewhere, something that's directly connected to climate change, before acting. I think that this is kind of meant to be a call to action. I'm very excited to know that you have a committee that's actively on it with a terrific group of people, but I think it's going to need to expand as part of the public dialogue if we're going to make good strides.
Absolutely, absolutely. And so I think we need a well-prepared line of defense, and we need to be really clear about that being collective. We need a tracking system so that we can really track climate change and its impact on health over time. We need to be able to really do a good job of investigating disease outbreaks, because those are more likely to occur more frequently. We need to have well-educated, well-trained providers. I think most providers right now have no clue what their role is in climate change, and that includes the public health community. And so we really need to put some time and effort into that, as well as the public. What is your role in this issue? And then just education and communication about it, so that we're not avoiding the issue, we're pretty much addressing it head on.
Yes, and I think that's a perfect place to close, because so many times I've preached health literacy as one of the most important things we should be investing in as a health community, as a public health community, and just as a education community in general. So thank you for that excellent point.
Thank you.
This has been a terrific hour together, and I just wanted to say this is Healthcare in Hawaii with Josh Green, Nancy Partika. We've spoken today about climate change and health, and I think you're going to see that this is an important emerging subject in the dialogue of our state going forward. Thanks for joining us.